I think it's because he presented very ill. And if you remember from the last time we had a big scare with Ebola, the sicker the patient is, the more likely they are to transmit. And so in making a decision like this, with the patient's degree of illness, we felt that if he had Ebola, then he could be very communicable to other patients and our staff.
There was no wiggle room for mistakes. So Denver Health's Chief Medical Officer Connie Price says when paramedics picked up the patient at his home in Denver this morning, they took every precaution. The 3 Denver Health staff members who transported him were put in isolation, and the ambulance they drove him in is quarantined. The patient was evaluated in the biocontainment unit, just the second time the hospital has ever used it. Dr. Price says it's unlikely he has Ebola.
All the evaluations so far and the testing have not supported a diagnosis of Ebola.
The hospital says the health department is still looking for a potential significant other of the patient, but Dr. Price says the general public doesn't need to worry about getting sick.
One of the reassuring issues with this case is that he became ill very suddenly early this morning. And so I think the likelihood of this patient being able to transmit to anyone in the general public is extremely unlikely, if impossible.